Good afternoon, everyone. As Sir had spoken, my name is Phumzile Mngomezulu from THU Care. We are supporting people who inject drugs. Under CDC funding, we have two provinces, which are Ehlanzeni in Mpumalanga and also Tshwane, which I am supporting. So basically, we have structured it in a way that is answering questions and also what have we done? Because I think in the space of anxiety and everything that's going on, we still had to find a way to continue to ensure that services still reach our people. So the first question that was posed was, how have you or your organization been impacted by the US funding cuts? And I think for everyone, we are echoing the same, that funding cuts have definitely made an impact. We received the stop work order in February, and for a period of 8 days, there has been service interruptions. There hasn't been access into the weekday drop-in centers. You know, drop-in centers are a safe space for our people. We have such vibrant and nice areas where it's like a TV, we have some bin bags, we'd have clients coming in to do their artwork, so they knew that this is the space where they're gonna receive love, they're gonna be respected, in addition to the care. So that was interrupted along with the ability to collect their treatment. We had 524 clients that were remaining on ART, antiretroviral therapy, and during that space, unfortunately, there were about 125 clients that have missed collections. That includes also pre-exposure prophylaxis. We had clients that are on methadone, and also clients that should have been collecting needles and syringes, and also accessing psychosocial services, because we have also formulated art adherence clubs, support clubs, just to make sure that there is a lot of support, especially for our homeless clients, because in Tshwane, it is in the inner city, so there's a very high rate of homelessness. So for us to ensure that there's consistent viral load suppression, we have improved retention and care, we have formulated those support groups, of which most of the time they're also being facilitated by the service users. So it has created a lot of anxiety, a lot of stress to our service users, because they were also having the same questions that we have. None of us knew what tomorrow holds. So as much as we were looking at our livelihoods, oh my God, are we gonna get paid? But there was a bigger picture to say someone else's health is gonna be severely affected should we not continue. Now that was showing the importance of our services to the underserved population. And within our operational areas in Tshwane, we had some KP-funded programs from USAID that have unfortunately exited the district. We had a female sex worker program that, they could not continue with their services. So because they know that as THU Care, we are also offering outreach services, we had now experienced an influx of female sex workers seeking care. And with the capacity that we have in terms of the staffing, we were designed, or rather our program was designed in a way that we can cater for people who are injecting drugs. But because we understand that health is very important, we had to work around our resources to ensure that we are able to extend our services outside our PWID service users, to ensure that no one is left behind, regardless of which key population they're coming from. So we have assisted in terms of HIV prevention commodities. Those clients that are already on ART, we would ensure that we provide services so that there's no disruption in care. It did come with a lot of pressure to the program, because the biggest thing is, for instance, in my team in Tshwane, we have a male-dominated team in terms of PWID. So they would go on outreach and be like, okay, guys, we need to go to this particular area because we have received that an alert to say, okay, they need condoms and it's female. So sometimes they would get there and, sorry for using this, but they'd find female sex workers, they're not wearing anything, and they would just be afraid and like, okay, do we cover our eyes? How do we help? So we also had to now reach out to our female sex worker program to say, how do we now ensure that we extend the services? How do we capacitate the team? Because we also don't know the duration of this challenge, but at the same time, we just could not leave them behind. So I think, as I've mentioned, that although this was really frustrating, we were looking at some robust resolution to say, what strategies can we put in place? What other collaborative work or activities that can ensure that there's continuation of care? So upon learning about the stop work order affecting other organizations, we as a team immediately implemented a contingency plan to try and minimize the disruption. Now, this included multi-month dispensing of treatment. So instead of giving 1 month, we would ensure that we gave 3 months of ART to the clients. We will dispense needles and syringes in bulk, including the containers where they could put the sharps containers, the needles for safety as well. So yeah, and in the process, we have been communicating effectively with our service users in terms of where they need to go for services, because part of our activities is to ensure that there is knowledge on services that are available in Tshwane and all the other service areas where we provide our services. We do not want to take ownership of our clients, but to make sure that should something happen and we can no longer continue, they know that they need to be linked to a Department of Health facility. And we are so grateful because we have what we call key population centers of excellence. So these are PHC facilities that are trained, that are sensitized to provide services to key populations. So with those constant engagements, we were just making sure that we're strengthening or paving the way for them to know exactly where to go if anything was to happen and we have no control over it. And in addition to that, we had a lot of collaborative work with other NGOs. I think our biggest support sister organization is COSAP. COSAP is providing methadone to people who use drugs in the district. So we also reached out to them. I remember it was Dr. Lorinda, may her soul rest in peace. She was leading that in terms of, she was like, no, Phumi, it's okay. Like, bring all the files, bring the methadone. We'll make sure that each and every client that you've started on methadone is able to continue during this process. So those partnerships, those very good relationships that we try so much to ensure that they are well sustained, actually assisted us to ensure that everyone still gets the service that they deserve. And then when we resumed with operations, we really prioritized tracing and re-engaging our clients back to care. We work closely with the PWID community. So we would find the clients in this area, they know that they would be responsible to just spread the word out. So during that week, we were literally, the whole team, even the data capturer and the cleaner, we literally went out with our mobiles just to make sure we cover as many service locations as possible so that they know that we are back and they can come back to access services. And also, we provided HIV prevention commodities, as I've indicated, to female sex workers. And because we know that they have been receiving services in certain areas, we are working very closely with the Department of Health in terms of the clients, for them not to be seen as lost in the system because of, it's easy to say someone is lost to follow up, but if they have been receiving care from our end, we would make it an effort that it is made known to the district so that they're also updating on the system as well, because we have received a very big challenge in terms of high numbers of lost to follow up. So as part of data monitoring and being able to be liable for, the performance and the resources, we were making sure also that every single female sex worker that is being serviced is also accounted for in the system. The last question was, how can INSU members as a global community best support each other in these times? As we have stated, funding cuts have really shaken programs on the ground, causing service interruptions, anxiety among clients, and putting pressure on teams trying to fill in the gaps. So I think that as INSU members, we can best support each other by staying connected and sharing practical solutions. That means advocating together for sustained funding, sharing ways to keep services running even with limited resources, and also offering support both technically and emotionally. And most importantly, we need to amplify the voices of affected communities to make sure that no one is left behind. Thank you.